From here, we're going to start on antipsychotic medications. I do want you to pay attention to the textbook when it comes to the introduction about antipsychotic drugs. So pages 189 to 193 in the textbook, make sure you read that, pay attention to the different boxes that give information. And then at some point we'll switch to the ATI book for the actual meds themselves. But the textbook does have very good information up to about page 193, and then I prefer how the ATI presents it. The antipsychotic agents block dopamine in the brain. It is thought, there's a lot we don't know about psychosis and schizophrenia in particular, but it is believed to be an overproduction of dopamine in the brain. And just the way not enough dopamine makes the person very stiff and unable to have spontaneous movement without difficulty, and gives a lot of muscle twitching. In the opposite direction, too much dopamine can just make a person lose touch with reality. So these particular drugs are pretty heavy duty. They are used for severe mental illnesses. And occasionally they will combine them with some of the tranquilizers like benzodiazepines and barbiturates because the patient might be very agitated. The usual expected side effects we're going to see with the traditional antipsychotics, the ones that have been around for years, headache, some GI problems, drowsiness. People who've been on the traditional antipsychotics talk about just feeling like a zombie. They don't feel like themselves. And most serious of all is something called EPS, extrapyramidal symptoms. And extrapyramidal used to be the old-fashioned version of talking about a portion of the brain that the drugs would stimulate to cause a lot of physical difficulties. And if you turn over to page 192, you can see pictures of these, what used to be called extrapyramidal symptoms. We've got pseudo-Parkinsonism. The person doesn't have Parkinson's, but they have similar symptoms because of the control over the dopamine in the brain. We've got dystonia, which involves a lot of involuntary movements and spasms in the head and body. Akathisia, which is restlessness, people not being able to control their movement. They just feel like they have to move. And then what's known as tardive dyskinesia, which is involuntary facial movements particularly, but also can involve involuntary movements of the body. So you need to know these terms and what they mean. Now, when it comes to the meds themselves, we will use the ATI, but make sure that you read over all this introductory material. It's very, very important and will help you kind of understand how problems manifest themselves with some of these antipsychotic meds. So switching to the ATI for the meds themselves, we're going to be looking at ATI pages 65 to 72. So your test questions are going to come from the ATI on the PowerPoint. So anything about antipsychotics that's mentioned here in the PowerPoint is fair game, but make sure you read everything in the ATI and that introductory material that I told you about in the textbook. So there are 3 categories of antipsychotics that are discussed. Conventional, atypical. Conventional are kind of the old school antipsychotics, the kind you always hear about back when people used to reside in these mental institutions. Atypical, which are newer, and then a drug called dopamine system stabilizer, or DSS. And as far as I know, there's only one of those that we'll discuss. Now, schizophrenia is the primary cause for somebody to need to be on antipsychotic meds. Schizophrenia is a very cruel mental illness that is characterized by periods of remission that are interspersed with profound distorted perceptions in the brain. Once it starts, it's usually lifelong. It can be very disabling, although it varies. Some people might have an acute episode, their first episode, and never be bothered again, especially if they have a lot of support and good medications. Other people go in and out of exacerbations and remissions. Nobody really knows the exact cause, but it does seem to have a genetic component. If you have schizophrenics in one family, it is not uncommon to find other schizophrenics. I was just reading a few articles about a family, books just been written about them, a family that had 10 children, I believe, and they were, I think, 9 boys and 1 girl, or 8 boys and 2 girls, something like that, but 6 of the males in the family ended up with schizophrenia. And so, definite genetic component there. So the 4 remaining children who did not have schizophrenia, you can imagine how bewildering that is to grow up in that situation and how difficult it was for their parents. And you hear a lot about people with psychosis hearing voices, getting unusual ideas that nobody else gets. And that's because the neurotransmitters, particularly dopamine in the brain, are so altered that it causes these problems inside the brain. So what we want when we are treating psychosis or schizophrenia with medications is to try to keep the acute episodes, the episodes that just pop up out of nowhere, keep them to a minimum. Try to keep recurrence of symptoms, and to keep the person with schizophrenia able to get out and live and work the best they can with the problems that their neurotransmitter issues are causing them. As we see in the textbook on page 189, I believe it is, we have some symptoms listed, and they're also discussed in the ATI. Schizophrenia can be separated into symptoms that are both positive and negative. Now, we're used to hearing positive and saying, oh, that's good, and negative as being bad. But in schizophrenia, positive means the person is doing things that they ordinarily wouldn't do, and negative is they're not doing things that they ordinarily should do to function. So with positive symptoms, we see that a person might get very agitated. They're going to have unusual ideas. They're going to have hallucinations, both visual and auditory. They will demonstrate abnormal speech patterns. And there are different things that they'll do. There's what they call word salad, where the person just speaks continually about things that make perfect sense to them, but sound very unusual to the person listening to them talk. And then there's flight of ideas, where they start talking about one thing and then that leads them to something else, which leads them to something else. Their thinking is very disordered. With negative symptoms, the person really stops functioning in society and may even withdraw within their family. And I'm going to stop because it's getting too long, but I'll come back to that.